the one thing that I do to help with patients adhere to lifestyle modification or changes, and that is meet them where they are. So if you work with a provider and they say you need to do X, Y, Z, this is what you have to do to control your diabetes, help with your perimenopause symptoms, help with inflammation, heart disease, high blood pressure, etc., and they don't meet you where you are, you need to ask them to break it down for you. So, for example, when I meet with patients to talk about whether it's their diabetes or hypertension, weight loss, perimenopause, I ask them, what are you doing now? What is your current status? And so I will have them list what type of physical activity they do, what their typical diet is, how much they sleep on average, what their water intake is, what their stress levels are. And then I meet them where they are with making minor changes to get them moving in the right direction and move that needle in the right direction. So say somebody doesn't exercise at all and they need to start an exercise program. I have them start with just a 5-minute walk, something easy, something basic. And then if 5 minutes is too much, we'll start with a 2-minute walk. And then we'll make one tweak in the diet. I have a patient who was helping them with their diabetes. This patient's on disability, limited income, had been pre-diabetic, and then following a hospitalization infection had developed full-blown diabetes. And so, again, went through those questions with them. Where are we at now? And this individual loved Mountain Dew. And so we discussed, okay, what are some changes that we can make to drink less Mountain Dew? And this individual also wanted to be drinking more water. So we discussed maybe using the little sugar-free flavor packets to mix in the water. And they're, again, on a limited income, and talked about you can get these at Dollar General, Dollar Tree, have a pretty wide selection. They made that one change, and it made a huge difference. So make sure your provider's meeting you where you are. Because if you come in and I tell you need to exercise 150 minutes of moderate activity a week, you're not going to do that. But if I say, let's start with a 5-minute walk 5 days a week, that's doable. Thanks.